हॅलो हॅलो
हां मॅडमचा आवाज आला का? हॅलो हॅलो माईक चालू ना. चेक चेक चालेल चालेल डिले राहील डिले.
हीच मुची प्रार्थनान हीच मुची प्रार्थनान हेच मुचे मागणी माणसाने माणसाशी माणसा समवागणे प्रांत भाषा वेश सारे संपू दे
धर्म जाती प्रांत भाषा वेश सारे संपू दे
एक निष्ठा एक आशा एक रंगी रंगू दे
Hello. So, dear audience, shortly our President Dr. Radhakrishna Vikhe Patil and Honorable Dr. Sushmita Vikhe ma'am will arrive in the hall. So, please be patient and calm. Welcome, welcome, welcome. With a huge round of applause, let us welcome all the dignitaries of the conference. Grand welcome and a warmest welcome for all the dignitaries, President, Chief Guest, Guest of Honors of today's function. I request all the dignitaries to please have a seat. Welcome and good morning everyone present here. Respected Chief Guest, Guest of Honor, Principal, Faculty and Delegates. I, Miss Nehal Pornare, request all of you to have your seat. So once again welcome each of you. I, Miss Nehal Pornare, holds an absolute honor to welcome each of you present for NRF sponsored 2-day national conference on From Plants to Patients, AI's Role in National Product Research, organized by Lok Nete Dr. Balasaheb Vikhe Patil, Padma Bhushan Awardee, Pravara Rural Education Societies, Pravara Rural College of Pharmacy, Pravaranagar, conveyed by Dr. Manga Thayaru K, Principal, PRCOP Pravaranagar, coordinated by Dr. Sunaina Vikhe, HOD Pharmacognosy, and Dr. Rahul Godge, HOD Pharmaceutical Chemistry Department. Respected Chief Guest, Guest of Honors, Principal, Faculty, and all dear delegates, your very presence here has lifted the spirit of our function. We are indeed grateful to you for accepting our invitation amidst your busy schedule. Your presence adds tremendous value to this event and motivates our college community to continue striving for excellence. So, on behalf of entire Pravara fraternity, I once again extend the warmest welcome to all of you. So, dear ladies and gentlemen, we are about to commence our event by lighting the lamp of knowledge and wisdom and paying homage by doing Pratima Pujan of the pioneers of PRES, Padma Shri Dr. Vittalrao Vikhe Patil, Padma Bhushan Awardee Dr. Balasaheb Vikhe Patil and Srimati Sindhutai Vikhe Patil. So to begin on an auspicious note, I will invite all the dignitaries to join us for ceremonial lighting of the lamp. We deeply appreciate their presence, marking the auspicious beginning of our proceedings today. This is a symbolic moment that signifies the dispelling of darkness and igniting of thought and enlightenment. Witnessing the lamp being lit may it inspire us all. The flame's upward movement, defying gravity, stands as a symbol of our quest for knowledge, upliftment, and the resolve to rise above all challenges. It stands as a testament to the power of light over darkness, knowledge over ignorance. As the lamp is lightening, it continues to radiate throughout the day. Let it remind us of our collective commitment to knowledge, harmony, and progress. May this light guide our discussions today. This is a symbolic movement that signifies the dispelling of darkness, the igniting of thought, and the enlightenment. spark lights continues to radiate throughout the day. Let it remind us of our collective commitment to knowledge, harmony, and progress. May this light guide our discussions today. Heartfelt thanks to our esteemed guest for leading this auspicious beginning. With this luminous start, we now officially declare the event is open and proceed with the further part. I request all the dignitaries to have their seat. To set the tone for today's session, we have a visionaries with us. Ladies and gentlemen, we now move towards one of the most heartwarming segment of today's event, which is introduction and felicitation of chief guest, guest of honors, and all the dignitaries on the dais. So today we are privileged to welcome and honor chief guest of today's national conference. So with a huge round of applause, let us welcome chief guest of the conference, Dr. Satish Sardana sir, Director, Amity Institute of Pharmacy, Amity Institute of Haryana, Gurugram. May I request Honorable Guest of Honor, Dr. Sushmita Vikhe ma'am, to grace this felicitation of chief guest of today's conference. So ladies and gentlemen, let us take a movement with huge round of applause and welcome chief guest of today's conference, Dr. Satish Sardana sir, Director, Amity Institute of Pharmacy, Amity University, Haryana, Gurugram. Every great institute is the hand of visionary who dreams and leadership that executes. Ladies and gentlemen, please join me in welcoming Honorable Dr. Sushmita Vikhe Patil ma'am, CEO, Loknete Dr. Balasaheb Vikhe Patil, Padma Bhushan awardee, Pravara Rural Education Societies, Pravaranagar. So put your hands together and let us welcome guest of honor, Honorable Dr. Sushmita Vikhe Patil ma'am. I would like to request Dr. Manga Thayaru ma'am to do the honor of felicitation. So guys, put your hands together and let us welcome guest of honor, Honorable Dr. Sushmita Vikhe Patil ma'am. Welcome and thank you so much, ma'am. We are also privileged to have with us the esteemed speaker and guest of honor, Dr. K.S. Ladda sir, Director of Yuka Enterprises, Mumbai. To felicitate sir, I would like to request guest of honor, Honorable Dr. Sushmita Vikhe ma'am, to do the honor of felicitation. So to felicitate the guest of honor, Dr. K.S. Ladda sir, I would like to request Honorable Shri Bharat Gogre sir to felicitate and do the honor. Also, we have with us our advisory partner, Honorable Shri Bharat Gogre Patil sir, Joint Secretary, Loknete Dr. Balasaheb Vikhe Patil, Padma Bhushan awardee, Pravara Rural Education Society, Pravaranagar. So to do the honor and to felicitate sir, I would like to request Dr. Ravindra Jadhav sir to do the honor of felicitation. Ladies and gentlemen, put your hands together and let us welcome Honorable Shri Bharat Gogre sir. Welcome and thank you so much, sir. We are also privileged to have with us esteemed speaker with great visionary, Dr. Ganesh Dama, sir. Dr. Ganesh Dama sir. He is Principal Sharat Chandra Pawar College of Pharmacy, Ottur, Chairman BOS of Savitribai Phule Pune University. So to do the honor of felicitation, I would like to request Dr. Sunaina Vikhe ma'am and Dr. Rahul Godge sir to do the honor of felicitation. Let us welcome them with a warm round of applause. Also, we are honored to have with us Dr. Sumit Joshi sir, Associate Professor, Sharat Chandra Pawar College of Pharmacy, Ottur. So to do the felicitation and to do the honor, I request Dr. S.N. Hiramad sir to felicitate sir. Also having with us our supporter and guide throughout, Dr. S.N. Hiramad sir. I would like to request Dr. Rahul Godge sir to do the honor of felicitation. Thank you so much. So, on the behalf of entire Pravara fraternity, I extend warmest welcome to all of you. I request all the dignitaries to have their seat. Now further, to formally open today's proceeding and set the tone for the event, I invite the Captain of Conference, respected Principal Dr. Manga Thayaru ma'am, to deliver welcome address and introduce the conference. Ma'am, please.
I humbly pay my respects to the visionary founding fathers of Pravara Rural Education Society, Padma Shri Vithalrao Vikhe Patel ji and Padma Bhushan Dr. Balasaheb Vikhe Patel, whose enduring legacy continues to guide the mission and growth of Pravara Rural Education Society and all of its affiliate institutions. I place on record our deep gratitude to our chairman, Honorable Dr. Namdar Sab, Dr. Radhakrishna Vikhe Patel, Minister for Water Resources, Godavari and Krishna Valley, Government of Maharashtra, for his continuous encouragement and visionary leadership that inspire all our academic and research endeavors. It is my privilege to extend a very warm welcome to our most respected Chief Executive Officer, Dr. Sushmita Vikhe Patel ma'am, for her dynamic leadership, meticulous attention to detail and unwavering commitment to institution excellence. These are just truly inspiring. A special and heartfelt welcome to our chief guest, Dr. Satish Sardana. He is a long-standing associate and a friend of mine, Director, Amity University, Gurugram, Haryana. He very graciously agreed to be with us today despite his demanding schedule. His keynote address immediately following the inaugural session will set the tone for today's deliberations and the conference theme. I also warmly welcome Sri Bharat Gogareji, Joint Secretary, Pravara Rural Education Society, and thank him for his consistent support and encouragement to all our initiatives. I cordially welcome our additional CEO and ever-present guiding force, Dr. Shivanand Hiramath, whose insights and leadership shape every major decision we take. I also welcome Dr. Ganesh Dama, Principal Sharat Chandra Pawar College of Pharmacy, BOS member. He is the guiding force for all of pharmacy representation, Pune University. We are very happy and privileged he is with us today, and he is also going to deliver a lecture for this conference. Thank you, sir, and I welcome you specifically to this August conference. I welcome Dr. K.S. Ladda, Director, Yuka Enterprises. His phytochemical isolations are actually very popular all over India, and most of us, when I was in Chennai, we visit Mumbai to do this. So I'm very happy to note that he's going to do his phytochemical isolations for our conference, and that is the highlight of our program. I thank the welcome other speakers who are going to shortly join us. Today, Dr. Abhay Gandhi, Director, IRA Consultancy and Research Organization, Pune, Dr. Shailendra Gurau, Professor, Department of Pharmacognosy, Goa College of Pharmacy. The expertise of these persons actually forms intellectual backbone of this conference. I am very happy and welcome my dear colleague, Dr. Ravindra Jadhav, Principal, Institute of Pharmacy, Dr. Tambole, Dr. Bankar, Dr. Sunil from Sharat Chandra Power College of Pharmacy. I welcome all our scientific evaluators from institutions across the district whose role is crucial in maintaining the academic rigor of this conference. A very happy welcome to the 532 delegates, including the 179 young researchers who are eagerly waiting to present their oral and poster presence across the thematic areas of this conference. The post-pandemic, just a brief note about the conference theme. The post-pandemic era has witnessed a renewal global interest on safer natural therapeutics and immune supporting interventions. So traditional systems and natural products are no longer at the periphery. Today they are central to global health interventions. Even big pharma companies are actively exploring nutraceuticals, and there is a huge budget in this area. So the theme of the conference is we need to encourage a lot of research on functional food and nutritional matrices, which are a very big business today. So at the same time, artificial intelligence is rapidly transforming every domain of knowledge. When AI converges with natural product research, it opens powerful possibilities from decoding complex phytochemical matrices and possible synergistic interactions to accelerating drug discovery and even clinical translation. So that is the theme of the conference. It was proposed from plants to patients, role of artificial intelligence in natural product research. Captures this multidisciplinary frontier where tradition meets technology and data meets discovery. With this vision, Dr. Sunena Vike, I want to mention the young people who have been part of proposing this conference. Keeping the current theme in mind, they propose and we made some changes, and it was this proposal which was submitted to ANRF, Anusandhan National Research Foundation. Very readily seeing the currentness of the theme, they came forward for supporting this initiative by giving a grant of 1.5 lakhs. We thank them, we are very happy. On record, we place our gratitude to ANRF for encouraging young researchers and a rural college like Pravara College of Pharmacy. So wherever you are, what you do is more important, not where you are. We are very happy and thankful to receive 22.5 thousand lakh from other private sponsors who are very eagerly, they came forward and supported us for supporting this very humble initiative of ours. A brief note on the program highlights. I am proud to share that our faculty team has worked tirelessly over the past few months to make this event meaningful and memorable to all of you here. Participants from over 56 institutions, as much as like Chennai SRM, Sri Ramachandra Institute of Higher Education Research, CMR College of Pharmacy, from Jalgaon College of Pharmacy, then Sandeep University, Nasik, D.Y. Patil University from Pune. About 56 institutions across the district, across Maharashtra, from different states have actually joined us. A special highlight is this the live phytochemical isolation by Professor K.S. Ladda. I have already told you, so that will be the highlight. I want all youngsters to join and make best use of this. In addition, tomorrow afternoon we have about 179 oral and poster presentations, and to encourage young researchers, cash prizes of 5,000, 3,000 and 2,000 respectively for the first, second and third prizes will be offered to the best presentations for motivating young researchers. Remember, this is an ANRF sponsored program and it will be a highlight for all of you. And most important thing is, on this occasion, we are delighted to release the second issue of our newsletter, Clinic Connect, a fully student-driven initiative curated by our PharmD students. The first newsletter was earlier released, and that was our BPharm and PharmD students have participated. See, please take a look at this newsletter. It is completely done by students, and look at the expertise and the meticulous care they have taken to bring this forward. Within the second issue, we are going forward to releasing it as a blog, as a LinkedIn newsletter as well, so that you will be able to encourage both professional participation and layman participation. So the newsletter is littered with campus highlights, achievements of our students, and another important thing, we will be releasing in this inaugural our souvenir, which you must note has received the ISBN International Standard Book Number, which gives a very special value to the citation when you cite it in your CV. Our students have also thoughtfully prepared some health-friendly chocolates for our guests. It has already been offered. We will now conclude, as we end the program, there will be a short video montage highlighting the vibrant academic and co-curricular activities at PRCOP over the last year. On behalf of PRCOP, I once again extend a warm welcome to all the dignitaries. I thank our chairman who was expected to be here. We were hopefully expecting here, Shri Bharat Gogariji, and all of them who are always with us on and off the conference. They are very helpful to us. They talk to us in every possible way. So I have to place on record each and every person's contributions. Thank you, and wish you all a very stimulating and rewarding conference. Welcome to one and all. Thank you.
Thank you so much, ma'am. So, dear audience, ladies and gentlemen, we have now arrived at one of the most anticipated segment of this inaugural session. To commemorate this gathering of minds, we have compiled official souvenir and a book of abstracts. So, to grace this moment, I would like to request Honorable Dr. Sushmita Vikhe ma'am for officially joining us of unveiling of souvenir. For official unveiling of souvenir, I would like to request our guest of honor, Dr. Sushmita Vikhe Patil ma'am, and all the dignitaries to please join for official unveiling of souvenir. So in order to commemorate this gathering of minds, we have compiled the official souvenir and book of abstracts. These souvenirs as a compass for this 2-day of the national conference. It houses intellectual labor of researchers from various colleges, institutes and research centers from all over the India. This souvenir or the book of abstract is featuring over 180 abstracts from all over the colleges from all over India. ERA Consultancy have given the ISBN number of our souvenir. Over past few months, many hands have been working on this. A special mention must go to the scientific and editorial committee, sorting through hundreds of submissions, curate this high quality volume. It was the tremendous task. Ladies and gentlemen, a resounding round of applause as the conference souvenir is now officially released. Dear audience, let us also take a movement for the release of newsletter Clini Pharma Connect. I now request Chief Guest of the conference, Dr. Satish Sardana sir and Dr. K.S. Ladda sir to kindly unveil the newsletter and present it to the assembly. I request all the dignitaries to join the official unveiling of the newsletter Clini Pharma Connect. Clini Pharma Connect. This newsletter is not just an ordinary newsletter, but it is the efforts of students which led to clinical pharmacy initiatives aimed at bridging the gap between pharmacological knowledge and clinical practice. The newsletter focuses on evidence-based medicine, recent clinical guidelines, drug safety, drug interaction, and the evolving role of clinical pharmacists in patient care. Ladies and gentlemen, huge round of applause and appreciation to the team of designing and editorial team. So Clini Pharma Connect, this newsletter is now officially released. Moving towards further part, let us take a movement to appreciate the efforts and initiatives taken by our students and faculty, and let us release our next project, which is blog and e-newsletter. To grace the movement, I now request one of the eminent speaker, Dr. K.S. Ladda sir and Dr. Ganesh Dama sir for official unveiling of the project, which is blog and e-newsletter. So let us take a movement to appreciate the efforts and initiatives taken by our students and faculty and release our next project, which is blog and e-newsletter. This blog is an academic initiative by PharmD students supported by our institution with the aim to promote rational and safe use of medicines, simplify recent clinical guidelines, highlight the role of clinical pharmacist in patient care, to create awareness about drug interaction, pharmacovigilance, and emerging therapies. And the e-newsletter, which is Clini Pharma Connect. Clini Pharma Connect is a student-led clinical pharmacy initiative aimed at the bridging gap between pharmacological knowledge and clinical practice. Newsletter focuses on evidence-based medicine, recent clinical guidelines, drug safety, drug interaction, and evolving role of clinical pharmacist in patient care era. A resounding round of applause and appreciation to the students and faculty of scientific team, designing team and editorial team of the conference souvenir, blog and Clini Pharma Connect newsletter. So, digital copies of all this project will be available on our website. Thanks to all the dignitaries for officially unveiling our projects. Now it's time for the chief guest address. To light our path with their experience and vision, I take a distinct honor to invite Chief Guest of the conference, Dr. Satish Sardana sir, to address the gathering.
Honorable Dr. Sushmita, Secretary, Pravara Rural Educational Society, the Principal, Dr. Manga Tayu, guests present on the dais, faculty, the students. It's a great occasion to be here. First of all, it looks great because weather here is very good. I am coming from Delhi, which is extremely cold. Weather is very good, pollution is very low. So I am coming from an area where both these things are adverse at this time at least. So it is a breath of fresh air here. And at the outset, I thank the management and the principal to invite me here and to interact with you all. As far as the theme of the conference is concerned, this is a very apt theme because at this time, the government of India is also initiating the Indian knowledge systems that have been almost getting extinct. So we are having a lot of this seminars, workshops, and also as per new education policy, we are implementing and incorporating the Indian knowledge systems. As you know, Indian knowledge systems are very vast. I mean, they are from astronomy to astrology to mathematics to medical sciences to production of medicines. Like you know that medicines, when they started, Charak was there, the Charak Samhita is there. Samhita is basically a treatise which gives everything about the medicines. Then surgery was there by Sushrut. So all these things were way before the modern science came into the existence. So it is time to again rebuild this thing. And as you see, rightly the ma'am said that after COVID, there was no treatment in allopathy or anywhere. Then we turned to the herbals, like Patanjali got out some medicines, and they were effective also. So we are going to our basic roots now. So going to natural products is always going back to the nature. We all are extension of nature, right? We are not different from nature, we are part of nature. But on the other hand, we are also responsible for maintaining this environment, nature and all this. These days, the main thrust on the education is basically about innovation. That is the buzzword. Publications are there, but publications mostly go for academic purposes. What reaches to the society, to the last man in the society, that is very important. Whatever inventions we do, they should go to the benefit of the last man in the society. And second important thing about inventions is the sustainability of the environment. This has become most important that we are observing. Like I told you, like in these 3 months, it is very difficult to live in the NCR region because of the high pollution rate. And that is causing all sorts of problems, asthma, cancers and everything. Life is being shortened. So this is our responsibility to maintain the environmental sustainability. So all research, all innovations should be based with this thing in mind before, and then only the inventions can be done. If you see a common example, if you see, was the discovery or invention or whatever you call it, polythene. That came around 30, 40 years back. Good old days, we used to take our bags and go to buy vegetables, then wash it weekly and then again take it. Nowadays, nobody takes it. They will bring everything in polythene. They will drink water in the plastic bottles, and then these, where they are going? They are choking the system. They are choking the animals. They are choking the drains. The fresh water is being spoiled. Heavy metals are being drained into the groundwater. If you test the water, metals are there. So a lot of patients of kidney, liver, they are emerging. So as a responsible student, as a responsible researcher, the need of the hour is to go natural, to have those inventions which are sustainable. This is very important. And innovations are very important because if you don't invent new things, life won't be easier. Life has become quite easier these days. But then again, we are producing a lot of these things which are not good for the environment. So keeping in mind, all the teachers, all the students should go for their work, and all the sustainable things should be done, right? And second thing is, they should go to the last man of the society. They are useful to the society. This time, the digitalization has come in a big way. It was gradually coming, but after the COVID, we found that teaching can be done online. Lot of work is being done online from home. So online has become a norm these days. So it is also good to have a physical conference that I am very happy about, because most of the conferences are having online. So online you can listen to it, but you cannot interact with people, you cannot talk to the people, you cannot meet people, which is the need of the hour. Because we are getting lonely, we are living in the virtual world, so it is very necessary that we should go out, we should meet people, we should get social. So that way these conferences are very good. But on the other hand, the digitalization also provides a convenience. Some people who cannot come from far away, they can present their work, or at least they have an opportunity to do this. So with this theme, because I will be talking later about this basic theme also, so I will not talk much about this now. So once again, I thank all the management and the principal and the institute itself. I am impressed to see the scale of the institution. That 100 institutions they are running and managing so well, giving so much to the society, back to the society. So many students are studying, and naturally they will get employment somewhere, they will be employable also, and they are getting good knowledge. The faculty is very good. I have met some of the people. So they are doing a great job. So thanks to them also, and I congratulate them on doing so much of this service to it. So the students must take care that they must utilize whatever is being given to them. Utilize to full potential. Student these days is a consumer. You pay the fees, you extract maximum out of it. And that you can only extract in the institute. ये आपका कर्म क्षेत्र यही है. आपको यहाँ आना ही है. And believe me, I tell you, अभी students sometimes they bunk classes, they won't come to the classes. अरे क्या करेंगे? When you are out of the college now, after 3-4 years or whatever it is, you are never going to return to the college. ये दिन गए. So use maximum of this thing. Come to the college, do innovations, out of the box thinking करिए, and you will progress a lot. Because lot of qualified persons are there, but competent persons are not there. Degree बहुतों के पास है, competence नहीं है. So we have to compete among the so many of people. वो कब आएगा जब हम एक्चुअली स्ट्रेस करेंगे, स्ट्रेन करेंगे और हार्ड वर्क करेंगे और डोंट वेस्ट एनी मोमेंट. एक्स्ट्रा करिकुलर इज वेरी इंपॉर्टेंट, फिजिकल एक्टिविटी इज वेरी इंपॉर्टेंट, which is reducing day by day. Day and night people are at the mobiles, they have a neck problem, they have eyes problem, all problem. Go and play out in the sun. That is the best thing to do. So these are few of my advices to you. Thank you very much.
Thank you so much, sir, for enlightening our path with your vision and experience. Now it's time for most awaited special keynote address. I take a distinct honor to invite Dr. Sushmita Vikhe Patil ma'am to share her wishes and guide us with her experience.
Ma'am, let me correct, there's nothing exciting. In fact, the speeches are very boring when it comes to me. They all have come to listen to them who are sitting there. Good morning, everyone. Respected dais, my dear faculty members and students. I was just checking on 2 or 3 things. Firstly, when such conferences happen, it's out of compulsion the attendance happens. Firstly, because people who come from outside also have to match, and then to fill in this space, we have to have our own students. But fortunately, I feel it's a different picture what I see here right now. 500 plus participants have come today, out of which 222 is from Pravara, rest everyone is from outside. So let's give a round of applause to everyone who has made it from outside as well. I would not much get into the technical aspect because there are special people who have come here to address. As a CEO standing here today, I can just say, as students, when I was at your place, I would not want to miss a single opportunity today also, why when I was a student, when a person comes from outside, to get and interact with him or her and how much maximum we can get educated from what their thoughts are, what their exposure is, that is something that will take you away from your own colleagues. Today also, whenever I travel, whenever I go outside, even sitting outside in Mantralaya waiting for a minister, a person who's come to meet him also, if you keep your ears open and you're open to understand and study, believe me, that is the most learning phase. Today, as students, when you're sitting in the front, we have dignitaries here on the dais. You have yourself come out of compulsion or without compulsion. But now that you are here, make maximum use of what you are here for. Because, believe me, sometimes in students' life you don't understand this, but only meeting and interacting new people, new ideas is something that's going to take you forward. From my personal experience, what changes you see in Pravara, they don't come overnight. They come with experience. They come with what your ground sweeper also tells you, what watchman mama also tells you, or what your principal or director also tells you. It's a community that we build, and everyone needs to be heard, and that's how you go forward. So in students' life, as sir has already said, it's not only the academics, but also the extracurricular that you need to focus on. So I wish you guys all the very best. Entire function, when I was taking out reading those, I was only asking them how much students are involved in this. So next time, this entire row also here, I would want the students to talk. That's how the confidence increases. This is how a student-led initiative should be, and I want all the students also. Next time when functions are there in your college, you have to be a part of planning. You have to be a part of this. I don't want teachers to play a role what students are supposed to do. We are just, आपल्याला फक्त त्यांना बोट द्यायचंय. चालायचं त्यांना आहे, ते पडणार नाही याची काळजी घ्यायची. But we cannot play the role of students, and that is how the new generation is going to be. And lastly, about the NSS camps also, I know this is not the forum, but again, I'll not get to meet you guys soon. NSS also, the other day I was in one of the NSS functions, last closing ceremony hoti. They told me there are 6 people who came and interacted in the afternoon. My simple question was, were the students involved to ask what kind of speakers do you want to hear? No. You guys decided the caterer should be given. If there are 100 students, why can't 10 students cook? Because NSS is for the students and by the students. We are just there to give you the facility. So my dear students, as part of management, I request all of you, if you guys are not getting enough opportunity, it is because you guys are not demanding. You guys have to be a part of the decision making. If students are happy, the faculty is going to be happy and the management is going to be happy. If students don't ask questions, the faculty is not going to improve their knowledge. I personally feel you guys need to trigger the faculty members. It is your generation who needs to come and ask questions which they should feel, yes, we need to upgrade our knowledge, because it's a teamwork. Parents, staff, students, if this triangle works in schools, in college it is the faculty and the students who have to take the initiatives and move forward. Thank you for inviting me here. I wish you guys all the very best. Thank you.
Thank you so much, ma'am, for your wishes. Now, before concluding the session, we have curated a special visual presentation. Please turn your attention to the screen. Technical team, please roll.
हाँ यही रास्ता है तेरा, तूने अब जाना है। हाँ यही सपना है
Team, please
तेरा,
pause the video.
तूने पहचाना है। तुझे अब ये यही रास्ता है तेरा, तूने अब जाना है। हाँ यही सपना है तेरा, तूने पहचाना है। तुझे अब ये दिखाना है। रोके तुझको आंधियां, क्या जमीन और आसमां पाएगा। जो लक्ष्य है तेरा, लक्ष्य तो हर हाल में पाना है। मुश्किल कोई आ जाए तो, पर्वत कोई टकराए तो, ताकत कोई दिखलाए तो, तूफान कोई मंडलाए तो। मुश्किल कोई आ जाए तो, पर्वत कोई टकराए तो, पर से चाहे अंबर से आग लिपटे, चाहे पैरों से नाग बरसे, चाहे अंबर से आग लिपटे, चाहे पैरों से नाग पाएगा। जो लक्ष्य है तेरा, लक्ष्य तो हर हाल में पाना है। हिम्मत से जो कोई चले, धरती हिले कदमों तले। क्या दूरियां क्या फासले, मंजिल लगे आके गले, हिम्मत से जो कोई चले, धरती हिले कदमों तले, तू चल यूं ही अब सुबह शाम, रुकना झुकना नहीं तेरा काम, तू चल यूं ही अब सुबह शाम, रुकना झुकना नहीं तेरा काम, पाएगा जो लक्ष्य है तेरा, लक्ष्य तो हर हाल में पाना है। हाँ यही रास्ता है तेरा, तूने अब जाना है, हाँ यही सपना है तेरा, तूने पहचाना है, तुझे अब ये दिखाना है।
Highlights the hard work and efforts taken throughout. This video perfectly encapsulates everything it stands for. Here is a glimpse of passion, the persistence and pure efforts of our incredible team.
हाँ यही रास्ता है तेरा, तूने अब जाना है, हाँ यही सपना है तेरा, तूने पहचाना है, तुझे अब ये दिखाना है। रोके तुझको आंधियां क्या जमीन और आसमां, पाएगा जो लक्ष्य है तेरा, लक्ष्य तो हर हाल में पाना है। मुश्किल कोई आ जाए तो, पर्वत कोई टकराए तो, ताकत कोई दिखलाए तो, तूफान कोई मंडलाए तो, मुश्किल कोई आ जाए तो, पर्वत कोई टकराए तो, पर से चाहे अंबर से आग लिपटे, चाहे पैरों से नाग बरसे, चाहे अंबर से आग लिपटे, चाहे पैरों से नाग पाएगा। रोके तुझको आंधियां क्या जमीन और आसमां, पाएगा जो लक्ष्य है तेरा,
It's a family. Proud to be Pravarites. Thank you.
So this video perfectly encapsulates everything we stands for. It is the glimpse of passion, persistence, pure efforts of incredible team. Thank you everyone for your attention. Now moving towards last part. So to express the gratitude and to conclude this formal inaugural function, I invite Dr. Sunaina Vikhe ma'am to deliver a thanking note.
Thank you, ma'am. So, on behalf of Pravara Rural College of Pharmacy, Loni, organized under the aegis of Loknete Dr. Balasaheb Vikhe Patil, Padma Bhushan awardee, Pravara Rural Education Society, Pravaranagar, I, Dr. Sunaina Rahul Vikhe, am here to propose the vote of thanks for the successful inauguration of ANRF-sponsored two-day national conference on From Plants to Patients, AI's Role in Natural Product Research. First and foremost, I express our deepest sense of gratitude to the Anusandhan National Research Foundation, that is ANRF, Science and Engineering Research Board, SERB, for generously sponsoring this national conference. Their valuable financial support and encouragement have been instrumental in organizing this academic event and in promoting research excellence in the field of natural products and artificial intelligence. We respectfully acknowledge the guidance and support of Pravara Rural Education Society, founded by Loknete Dr. Balasaheb Vikhe Patil, Padma Bhushan awardee, whose vision continues to inspire quality education and research initiatives. We extend our sincere gratitude to our Chief Patron, Honorable Namdar, Dr. Radhakrishnaji Vikhe Patil, Honorable Minister of Water Resources, Godavari and Krishna Valley, Government of Maharashtra, and Chairman, Loknete Dr. Balasaheb Vikhe Patil, Pravara Rural Education Society, for his visionary leadership and constant encouragement towards the academic and research development. We are grateful to our respected trustee, Pravara Rural Education Society, Honorable Mrs. Shalintai Vikhe Patil Ma'am, Ex-President Jilla Parishad Ahmednagar, and trustee, Pravara Rural Education Society, as well as Honorable Dr. Sujaydada Vikhe Patil Sir, Chairman, Padma Shri Dr. Vithalrao Vikhe Patil Cooperative Sugar Factory, for their continuous support. We are deeply thankful to guest of honor, Honorable Dr. Sushmita Tai Vikhe Patil Ma'am, for gracing the inaugural ceremony with her esteemed presence and for delivering such a motivating lead address that will greatly inspire our students, researchers, and faculty members. We sincerely thank you, our advisory committee members, Shri Bharat Gogre Patil Sir, Joint Secretary, Pravara Rural Education Society, and Dr. Shivanand Hiremat Sir, Additional CEO, Pravara Rural Education Society, for their valuable guidance and support. I express our profound respect and sincere thanks to our esteemed chief guest, Professor Dr. Satish Sardana Sir, Director, Amity Institute of Pharmacy, Amity University, Gurugram, Haryana, as well as we also extend our great heartful thanks to our guest of honor, Dr. Ganesh Dama Sir, Principal Sharachandra Pawar College of Pharmacy, Otur, Pune, and BOS member, Savitribai Phule, Pune University. We sincerely thank you to our eminent speakers, Professor Dr. K.S. Ladha Sir, Director, Yuka Enterprises, Dr. Shailendra Guru Sir, Professor, Goa College of Pharmacy, Panji, Goa, and Dr. Abhay Gandhi Sir, Director, ERA Consultancy and Research Organization, Pune. We place on record our deep sense of respect and gratitude to our respected principal and convener, Dr. Manga Thairu Ma'am, Principal, Pravara Rural College of Pharmacy, for her visionary leadership, constant guidance, and tireless efforts, which were instrumental in the success of organizing this conference. We are thankful to Dr. Ravindra Jadhav Sir, Principal, Institute of Pharmacy, for his continuous support. We are also thankful to Dr. Tambori Sir, Director IBMA, as well as Dr. Bankar Sir, Director of Pyrons, for providing us the hall arrangement and facilities. We gratefully acknowledge ANRF as the sponsoring agency, along with the continued support of Pravara Rural Education Society for making the conference possible. Our heartfelt appreciation goes to organizing committee faculty members, non-teaching staff, and student volunteers for their dedication, teamwork, and tireless efforts in making this inaugural program and conference proceedings smooth and memorable. Last but not the least, we are thankful for all the participants, whoever have came from various colleges, who are sparing their research, who came here to grace this occasion, to grace this conference. Once again, we express our sincere gratitude to everyone who directly and indirectly contributed to the success of this program. Thank you all.
Thank you, ma'am. So here we have concluded our formal inaugural function. Now I request all the audience to please stand for a national anthem.
जय हे जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उज्ज्वल जलधि तरंग तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
So thank you. Here is the conclusion of formal inaugural function. So dear delegates and participants, be patient and please be seated in the hall itself. Shortly we will start with our first session by Dr. Satish Sardana sir, chief guest of the conference.
Check. Hello. Hello. Check. Check. Hello. 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 Check. Check. Hello. Hello. Check. Check. Hello. Hello. Check. Check test. Hello. 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 Check. Check. Hello. Hello. Check. Check test. Hello.
बॉटल आहेत ना आपल्याकडे आता बॉटल बाकीचे सगळ्यांना घेऊन घेऊ
Immediately we are going to start with our first session of chief guest, Dr. Satish Sardana sir. So please be seated in the hall itself.
Respected dignitaries, estimated delegates, faculty members, researchers, and my dear participants. It's a matter of great honor and privilege for me to introduce today's distinguished speaker, Dr. Satish Sardana sir, a highly respected academician and leader in the field of pharmaceutical science. Dr. Sardana sir has an illustrious career spanning over the 4 decades with nearly 44 years of rich experience in teaching, research, academic administration. Sir holds a master's degree and a PhD in pharmaceutical science and currently serving as the director of the Amity University of Pharmacy, Amity University, Haryana, Gurugram. Dr. Sardana sir has made a remarkable contributions to the academia and the research. Sir has actively organized numerous national and international seminars and conferences and has been associated with many academic platforms as a speaker, chairperson, and the resource person. Sir is also a valued member of several academic and statutory bodies across the universities in the India. His scholarly achievements are truly commendable. Sir has authorized 5 books, holds 10 patents, and has published around 100 research articles in reputed national and international journals. In addition, Sir has successfully gained several PhD and MPhil scholars, contributing significantly to shaping the future researchers and the academicians. Dr. Sardana Sir's research interest includes herbal drug technology, phytomedicines, and the drug delivery system, areas that are highly relevant and impactful in today's pharmaceutical research landscape. He is a life member of prestigious professional bodies such as APTI, IPGA, IPA, IHPA, SPER, and the Society of Pharmacognosy. He is also actively involved in quality assurance and the accreditation activities, including IQSC, NRIF, NBA, and the NAC. With a vast experience, deep knowledge, and inspiring leadership, we are truly fortunate to have him with us today. Ladies and gentlemen, please join me in extending a warm and respectful welcome to Dr. Satish Sardana Sir, and we eagerly look forward for his insightful session on the topic Artificial Intelligence in the Drug Discovery and Natural Product Research. Sir, the stage is yours.
Thank you so much, Pratiksha. Thank you for introducing chief guest of the conference. Sir, the forum is all yours.
Yes. Good morning. So we start with this session. This is a 2 days conference. So this is the first your lecture on this topic of artificial intelligence in drug discovery and natural product research, right? Now you see there are 2 contrasting words in this. What are those? One is artificial, second is natural, right? The resources are natural and you are using intelligence artificial, not human intelligence, right? Because although there is no match to the human intelligence, because all artificial intelligence is also a brainchild of human intelligence. But the amount of data that we are generating these days is not simply possible to be done by humans. So the algorithms, the calculations are there, and in an instant you can get the result. And AI is basically a part of digitalization, right? That is happening from such a long time. During COVID period, we learned the importance of digitalization because we were confined to our homes, we were not able to walk out, we were not able to interact. So all activities were standstill. Had there been no communication via this digitalization, it would have been very difficult for us. All the information that was reaching to us regarding COVID, regarding drugs, or our other things was through only digitalization. So after digitalization, you have seen most of the people have inclined towards it. It is getting very difficult to come back to that the physical form. Most of the companies are offering digital jobs. People are doing from home, work from home is there, because then people realize that this is a good system. Why? Because you need not have any space, no rental is to be paid, you are working from your home, no transportation, no traffic jams, nothing, and yet you are doing it. But there are many jobs which cannot be done digitalized, only records and all those things. Like in the hospital, if some patient has to go, there has to be a doctor, it cannot be. Though some consultancy is there on the digitalization part. So as far as natural product research we call it, all the natural products they are coming back into the picture. Previously we thought that this is only the kitchen garden that we use medicines from there for some headache, from some stomach ache. But nowadays authentic research is going on. There are two kinds of natural products in the market, if you see. One is the mixture of so many things. I mean, there can be mixture of herbs, mixture of extracts, or even if one plant is there, it is the extract of that. And believe me, that extract, as you are a student of pharmacy, you know, every plant contains more than 60, 70 phytoconstituents. So this is, हम कहते हैं ना, nature का करिश्मा है. It is a miracle of the nature that all 60 constituents remain in uniform, this thing, in symbiosis. These days two people cannot live in symbiosis. लड़ाई हो जाती है 2 दिन के अंदर, हो जाता है ना. पर यहाँ पे 60 constituents एक साथ रह रहे हैं, and then they are flourishing. वो plant flourish कर रहा है. तो ये nature का this is the. तो उसको explore करने के लिए, to explore that, we need some sciences. अब basic drug discovery क्या होती थी? We will go slide by slide. These are some of the examples. Like poppy, we got morphine, and then we got other this thing. Second one is this Syncona, and this. Okay, let's start from the introduction. This is the 21st century, is the digitalization in all sectors. Before that, digitalization was. Artificial intelligence is a part of digitalization, though it is more advanced, but basically it is a part of digitalization. So digital transformation was there, technology and business processes were there. Then COVID-19 pandemic challenged the healthcare system because the problem was so huge that healthcare system could not simply cope with it. So oxygen shortage there, bed shortage is there, the virus was there, the vaccine was not there. India made vaccine at a very short notice. So that was credible and it exported to 40 countries. Like Serum Institute of India made the vaccine, Bharat Biotech made the vaccine, Covaxin, and they exported. Other foreign companies were there, like Pfizer, these Johnson & Johnson were there. So after COVID-19, this digitalization was, there was need to develop new technologies, right? And that they were the solution to challenges. Now the digital health market is valued at US dollar this much, and it is growing at a rate of almost 20%. So by this, you can understand what kind of opportunity is there for all researchers, for all people to go into the AI. But before that, I tell you that you have to learn AI. What is AI? You need to have some short-term courses for AI, understand the AI, and then you can go to amalgamate that AI into the research, particularly in the natural product research. This was again during the COVID time, the contact tracing was done. Then this was the mobile phone applications were there. Quarantine self-isolation was there. Again, mobile phones were used for that. Screening for infection was there. AI and ML was, machine learning was there. Clinical management, then pharmaceutical product and services, testing, prevention, treatment, they all were done this thing. And tracking was very important because the patient had to be isolated. So it was required that whosoever has this COVID or something, he has to be isolated. So all the data was required. And because of this huge data collection, data analytics, we were able to control this thing. Yes, थोड़ा सा और आगे बस हाँ yes थोड़ा सा बाबा ठीक है can all see okay. So basically, what is artificial intelligence? I think this will not do. आवाज ठीक है? Yeah. So now, what is the artificial intelligence? Artificial intelligence is described as the technology as an artificial brain. Because our brain is there, it is the most intelligent thing on earth because everything is been created by this brain only. You are seeing a lot of wars are happening, drones are going, the missiles are firing, the atomic bombs are coming. This is the destructive part. And the constructive part is there, all the new technologies for healthcare are coming. This is all because of the brain. But because we have developed this artificial brains in form of machines, right? Advanced programming is done. And nowadays the OpenAI is there that automatically collects the data from all over and gives you whatever you require, right? To learn from the experience on its own and can adapt to the new pieces of the information. So as per Encyclopedia Britannica, it is the ability of the digital computer-controlled robot to perform tasks commonly associated with the intelligence being. That means the artificial brain is being used for precise work. Then it is basically a way of making a computer, robot or software think or act like a human, or even more than that. Like a doctor sitting in USA can perform surgery here, controlling the robots and all those. So that is also a artificial intelligence, simulation of human intelligence machines and programmed to think like humans and mimic their actions. Same actions are produced, right? This is the historical journey of artificial intelligence. Intelligence is the basic trait of a human being, right? 1942 it started with artificial intelligence भी होनी चाहिए. पहले लोग सोचते थे human brain है, there should not be any machine that can make mistakes, and mistakes have been made. ऐसा नहीं है कि गलत नहीं हुआ, wrong commands have been given, wrong things have happened, and then gradually it increased to now it has come to 2020 तक आपको chat GPT और ये सब आ गया है, which can text, images, सबको अपना बता सकता है. So this has increased. This OpenAI announced chat GPT-4 that receives both text and image prompts, right? This is the AI in daily life. AI is basically a digitalization. In all our life, we are using all the digital tools nowadays. That has made us everything convenient. Like I went for Shirdi Darshan, it was online booking. You got to get a slot, you show your iCard, you go inside, it was flawless. So whatever machine does, that does flawless. Human mistakes or human errors are not there. It is precise. But if wrong command is there, it will do wrong with precision. Then there is no reversion. So you have to be very careful with the machines and to have full knowledge. You see banking, finance, social media, you all are into social media, then video games, e-commerce, security and surveillance. These days the wars are fought on security and surveillance, right? The days are gone when the army used to go inside and fight. Now there are drones, there is surveillance, there are satellites which are mapping each and everything, and the precision strikes are there. And they are so much precise that there is no collateral damage. It will actually strike to that place. So this has become possible because of the artificial intelligence, digitalization, and different tools like that. Vehicle recognition that you have seen, you go to a toll, you cross, you don't have to stop, it is already recorded. Then healthcare, this is very important, which we'll be discussing in detail. Healthcare, because health is the most important concern of a human being, right? By natural means, by artificial means, or sorting out diseases, or preventing diseases, or vaccination drives, or any other things. That healthcare, this is very important. Navigation and travel, these days everybody travels with AI. You search the destinations, you book the hotels, you go by airplanes, everything. Agriculture, it is coming in a big way now, because then they map that area, whatever the climate is, which crop is suitable, when it is to be grown. Like some people have replaced the normal crops like wheat and those things by medicinal plants, because they give high value to you. They have distribution centers, like we have one distribution center at our university, which we grow the many plants, and then the farmers come and we tell them to replace them, and then we set buyer for them. That is all done through this thing. Then media, streaming and services, all the media. You see numerous news channels are coming up because it has become easy. The connectivity is better. And then travel and personal assistants are there, like Google Assistant, and all those are there. They can guide you. Siri is there. So many things are there. Mobile banking is there. So you can bank, you can withdraw money, you can transfer money, you can do anything. So all these things are this thing. Online shopping is there. This has become a favorite pastime of so many people. If nothing is to do, go online and shop something, and your money will be automatically gone from the bank. So you don't feel something is out of your pocket. It is going, you don't know. When the bill comes, you see, oh, I have spent so much of this thing, right? And then social networking is there, Twitter, Facebook, and LinkedIn, and all those mobile applications. So many applications you download. That has become easier. You don't go to a website. You have to download an application. All the work will be done by that application. All these things are available there, right? And then emails, etc. Even people are making emails with GPT. They want whatever it is. Even PhD students, they are coming with synopsis. They make it with GPT, so, chat GPT. So everything, but that is known. Nowadays, if you publish a paper, you have to give an undertaking. Which AI tool you have used, why you have used. You have to give a disclaimer that I haven't used any AI tool or something like that. Because it has become easier. At that time when we were undergoing research, or most of the faculty, we used to go to see chemical abstracts. They were big, thick books having abstracts of all these things. And then you have to sort out which page it was. Then you have to write it down. At our times, there was no photostat copying, so we had to write it. Nowadays, the literature survey is complete in 3 days. They will go and search everything, sort out whatever is required, whatever is not required. You get the latest paper on your mobile. So it has become quite easier because the data is so great that it is not possible to search out of that, right? Now this is the part that we will be discussing. This is the AI in healthcare. AI can use algorithms to learn features from a large volume of healthcare data. Basically, it can assist in clinical practices because any drug is to be used clinically, right? So before that, clinical trials will be done. So clinical trial management can also be done by AI, and other clinical practice like diagnosing disease, developing personalized treatment plans, assist clinicians with decision making. Because sometimes the symptoms, you cannot decide what disease is there. Even the medical tests will show otherwise. So AI can assist what kind of diagnosis a doctor has to make, what decisions he has to make. So these can be done by AI. It can assist physicians by providing up-to-date medical information. And sometimes happens, previously what happened, like this, we are having seminar conferences. The doctors used to go to conferences to learn new techniques, to know what is happening nowadays. Workshops were there. Now AI can give you all information sitting in the cabin. So doctors are almost knowing everything, whatever is happening in the world, whatever new technology comes, that comes on AI. And you can even learn from AI. Then they can, because of this, these can reduce the diagnostic and therapeutic errors, right? And health risk alerts are there. Like you will see somewhere swine flu is going on, so health risk will come, alert will come. You are going to that area, there will be alert. This is the disease that is prevalent here. You should not go there. And what will be the health outcome prediction will be there. So these are the things that can be used by AI. Now clinical research is a very important part because any new drug or any vaccine or anything that comes into the market has to undergo clinical trials. Normally we test on animals and we find it safe, then we go to human beings. There are phase 1, phase 2, phase 3 clinical trials. So a data set of persons is to be taken and then it is to be clinically tested. Like COVID came, clinical trials normally take around one year to complete, but when this COVID came, the clinical trials were done in 1.5 months or so because it was urgently required. The vaccines were immediately required. So many, maybe some data can go wrong also in this case, but because that was the need of the hour, so that the vaccines could be put into the market, and like almost all of you must have gone through 3 vaccination phases in COVID-19. So these were available at that time, and all the data was, by the use of AI, it could be expedited, right? AI in pharmaceutical industry, you see clinical design, you can do QA and QC, it is required. QA and QC, you can then automate your, modify your further production procedures and all those things if you know about the some inputs from the QA, QC. And then manufacturing is there, these days automatic manufacturing is there. Personalized manufacturing can be done, suppose there is a requirement of some special medicine for some area, that can also be done. And then manufacturing errors are there, they will be well noted and they will be taken care of. Then pharmaceutical product management, that means you can modify the product according to the needs, according to the inputs through AI. Drug discovery is again very important, and AI is extensively being used in drug discovery. You will see that, you will be surprised to know that no new drug molecule has come out for last 60 years. To last 60, 65 years, no new drug has come, only repurposing of drugs has been done. No new antibiotic has come, So that's why these days when antibiotic resistant diseases are coming, there is no new antibiotic to take care of. So it is very difficult because drug discovery process is a very extensive process. Suppose you test a drug, it is very effective. But now what? If you go for its biopharmaceutics, pharmacokinetics, it is not being absorbed. Suppose it is being used for brain, does not cross the blood-brain barrier. It is crossing the placental barrier, so it's harmful to the infant. And at various levels, it can be stopped. Because it has to be perfectly safe. Toxicity studies are to be done. And then, suppose you invent this drug now. After 10 years of use, it is harmful. Then what do you do? Because currently it is looking safe. So, drug discovery process is very tedious. Because of the knowledge that we have gained, because of the toxicological studies that we perform, it is very difficult to get one molecule of the drug. Right? This we can further see. Pharmaceutical product developments can be done. The product can be developed into different dosage forms, different dose, different application procedures, and different this thing. Drug discovery, I told you, this is very important because bringing out a drug to the market is extremely difficult. Right? So, what do you do is, you go for drug design, polypharmacology means multiple uses of the drug there, chemical synthesis. Previously what happened, you synthesize, like you see old medicinal chemistry journals, they have a data set of antibiotics or anti-HIV or whatever the disease is. There are 40, 50. Then they will synthesize those, they will modify one chemical group, synthesize 40 drugs, similar pharmacophore, different functional groups, and then they calculate IC50, and then you see which one is effective, which one is not effective. Right? That was the procedure. But now the tools have come, they will predict the molecules. How many molecules out of, let us say, thousands of molecules you can screen by AI. And you will take out the lead molecules, let us say 5, 7 molecules. And then synthesize them and then actually test them. So the process will be validated, that whether AI is telling correct or not, and you have to synthesize only that much. And then comes the next part, whether it is effective, then the other part, toxicological studies. These things can also be predicted, right? This is in clinical trials. I won't go into the detail. This is where it can help. It can help in trial design, protocol development, then patient identification, because you have to identify the set of patients whom you are giving this drug. So taking their data, taking their medical history, taking all these, compiling it to one, and then they sort out that this data set of patients is to be taken, patient engagement, and then data integration, whatever data you get, integrated, and then predict what can be done. Risk prediction, remote monitoring, site selection, AI efficiency, and then compliance checks also, and then document generation. Because ultimately you have to produce the document of this clinical trial to the regulatory body for drug coming to the market. If the data is safe, only then the drug can enter the market. So clinical trials are very important. Pharmacy graduates have a lot of opportunity in this area also, because for all the drugs, one has to go through clinical trials, right? And this cost reduction will also be there, because a lot of people may not go there. They can actually collect the data through healthcare. Healthcare, it is the developing of new drugs, tackle the diseases, make sense of the clinical data, then find the correct patient from clinical data. This is a brief summary of the healthcare. Now the herbal drugs, we will talk a bit about, because that is the theme of this thing. Traditional system, these were the traditional systems of medicines. Ayurvedic system, this is an Indian system, right? Unani system, to some extent Indian system, and Chinese system is a different, but it is a indigenous, traditional system. You can call for China. This is a very common system. Siddha system, this is in Tamil Nadu, this system was very prevalent, Siddha system. And homeopathic system, though not Indian, it is said to be originated from Germany, but widely followed in India. But one thing is common about all these systems. And what is that? In all these systems, the herbals are used. In all these systems. Their names may be different, but in all these systems, you use that system. And what is the modern system? You take the lead molecule, separate the phytoconstituent, and individual phytoconstituent is assessed for this thing. This is basically a chart. These are different types of natural products. Some are pure natural products, some are modified, some are semi-synthetic, some are synthetic. This is the, again, drug discovery, process development, this is the same. And this is the random approach is there, which was previously followed. You take a random plant from folklore, this thing, even now we are doing research. Then you isolate the phytoconstituents and see their bioactivity of the active constituent, maybe extract or this thing. Because two types of products, herbal products will be there. One will be the mixture of extracts of many plants. Like you see some tablets, like you see Live 52. You will see there are more than 50 herbs in it. 50, 40, 50. So having so many herbs, they may have interactions. So there is no validation actually of these products. So for validation, you need to have a separate phytoconstituent. Then you know, like in allopathic system medicine, if fever is there, you give paracetamol, fever comes down. Evidence-based, you know it. In Ayurveda, eye fever is there. What Ayurveda medicine you will do? Can anyone tell? You don't know, because there is no medicine, right? So evidence medicine can only become be available when there is only one phytoconstituent that you evaluate. And when you mix one or more, then there can be drug interactions and those things also, right? This is bioactivity directed, which is now normally followed. You make an extract, then you fractionate it into different fractions. Each fraction is evaluated. Phytoconstituents are separated from each fraction. They are evaluated. This is the more scientific approach by chromatography and all those things. You do it, right? Now, these are some examples that I am telling you because we are discussing natural products like atropine. Atropine, you know, it's a pupil dilator. Previously, many years back, when we used to go to doctor, he puts atropine and pupil is dilated so that he can examine the eye. These days also pupil dilators are put, but due to some side effects of atropine, some other semi-synthetic derivatives are up. This is an example of natural product, and Alchem Laboratory is making this product by atropine. So it is not that natural products are not available in the market. They are available, right? This is, it comes from the atropapanadol, right? Then pilocarpine is there. It is used to reduce the intraocular tension in glaucoma and all those. You put a drop, it will reduce it. But now better drugs are available because it causes meiosis and other things. So not much use, but it is still available. 10, 20, 30 years back, this was the only drug available to reduce the intraocular tension. Because glaucoma can cause blindness. It can damage your optic nerve. So it is necessary to reduce the tension. So that was the only drug available. The plant was Pilocarpus jaborandi. Then morphine, you know very well. Now this morphine is a common narcotic analgesic, which is obtained from the opium, Papaver somniferum. Other things are morphine, noscapine, codeine, thevane. These are other alkaloids which are available in morphine. And this morphine, you see, this is the OH. You replace this H group with methyl group, right? It becomes codeine. You replace it with acetyl group, it becomes diacetyl morphine, that is heroin, and the activity changes. The morphine is analgesic, codeine is antitussive, कफ के लिए है. Heroin जो है वो drug abuse में ज़्यादा use होती है. Why? It is 40 times more potent than morphine. So by changing a simple group, you can modify the action. So that is why the semi-synthetic derivatives arrived after the natural products. Quinine, you all know it is anti-malarial. But now, again, we have chloroquine and other drugs available. Yeah. So this is from the Cinchona plant. All these plants were used long back because then the synthetic drugs were not available. The treatment was done on the basis of the experience, hit and trial. Isko denge kuch ho jayega. So there's a story for Cinchona. There was a countess known as Cincan. She had fever, so somebody gave him this bark extract. The fever was reduced. It was because of malaria, but it reduced. So they named it Cinchona, and there are other species, Cinchona carisaya, saxifrage, officinalis, many other species of Cinchona are there. Cipla is making the tablet. So these products are ergotamine. This is oxytocic drug. It increases the uterine muscle contraction. So ergot from claviceps purpurea, it is obtained, right? Then reserpine, you know, Sarpganda, it is from Rauwolfia serpentina, antihypertensive drug. Not much used nowadays, but tablets are available. But if you go to some Ayurvedic Vaid, he may give you powder of Sarpagandha. Ashwagandha is extensively used because that is an anabolic drug, and that is in many products also people use. But Sarpagandha is dangerous. You cannot take it because it will drastically reduce your blood pressure, right? So this is reserpine tablets, USP are available. A USP means it is in the United States pharmacopoeia. Can you imagine? So it is not that the herbal products are not there. More than 85-90 molecules are from the herbal origin. And numerous drugs are made from the herbal phytoconstituent, semi-synthetic or in a synthetic way. Vinblastine, you know, anti-cancer drug, this is available in the market, being extensively used. Digitoxin is a cardiotonic drug. Digitalis purpurea, this is again being used. Stenocytes are purgatives. Like you see, Kayam Churn. Kayam Churn has 50% of senna leaf powder, which contains stenocyte A and B. And it is purgative, आपके stomach को clear कर देगा. Anthracene glycosides, that is irritant type of purgative, right? So this tablet, now they write natural vegetable. They are marketing it like that. Then paclitaxel is from Texas. This is the anti-cancer drug. This is actually being used. The artemisinin is again anti-malarial drug, better than quinine and all those things. Obtained for artemisinin. I am showing some examples from where actually the herbal products, phytoconstituents have been separated and they are being extensively used in the treatment of diseases. Cannabidiol, this is anti-epileptic, otherwise it is also a very good, what you call, mood lifter and body pain dur ho jayenge. So some places it is banned, but in some countries like Canada it is available. If you take some cannabidiol or cannabis, so all your pains will be gone. You will be very happy like that. But in India it is not allowed, right? Then synthetic drugs also that this is another example that from lead herbal drugs, natural origin, we have developed some synthetic drugs also. They can be made from the pharmacophore, from the natural, or they can be entirely synthetic, but they are also found in the natural. This is thalin is there from hemivisamka, is a bronchodilator drug. Then this is anti-diabetic drug. This is isolated from Galega officinalis, galegine from, you see metformin is a very common drug for anti-diabetes. This is commonly available. Everybody, whosoever has diabetes is taking metformin. And this is basically derived from a plant source, and then it is, you can synthesize metformin also, you can make it from galegine also. Papaverine is there again from Papaver somniferum, antihypertensive disease. Now what are the challenges? As I told you, the plants have numerous constituents. So challenges are more. Like you have to handle more people, challenges will more, one will face something, one will face something. Right? If you have less, challenges are less. So challenges are there, molecular complexity. Number one, the plants, you have seen the structures of the compound, like you see the structure of reserpine, you see the structure of quinine. They all have a very big structures, heterocyclic rings and all those. Alkaloids all have heterocyclic rings. So structures are long, bigger, so there are a lot of complications because their properties will be different. So while formulating, while extracting, while analyzing, there will be challenges. Some have very poor bioavailability. Like I told you, you test one drug, it has a very good action. But when you give it in the body, it is not absorbed. What do? It won't act. So it is failed, it is not a good molecule. So a drug can fail at many levels. So poor bioavailability, functional group, lot of functional groups are there, they are reactive, they may bind to proteins of the body, they may bind to each other, they may create instability of the product. So a lot of things can happen with functional stability, and general instability is always there with plant products. We make herbal drugs and we have a notion that all herbal drugs are safe. It is not. It depends on the constituents, and all herbal products, whatever you are adding to them, they can undergo reactions, drug interactions. The product can be spoiled on the shelf. So it is very carefully you have to see what kind of product you are making and how much is the shelf life. So stability studies are to be seen. Like this is the molecular complexity. You see this is the Texol, Texas, and this you see how much complex the molecule is. And then low solubility, poor bioavailability of this product. Quinine alkaloid is from Camphothecia acuminata. It has anti-tumor activity, but because of its low aqueous solubility, it produces severe toxicity. Then functional groups, these are different compounds, have different functional groups, right? So they can interact with other phytoconstituents, they can interact with the nutrients that you are taking. Like these days, many people are taking herbal supplements and all those things. So herbal supplements, we consider it safe. It is not. You have to carefully take unnecessary. Why should one take herbal supplements? Because they will interact with your this thing. Even if you are undergoing treatment of some disease with a doctor, you should tell, I am taking these herbal supplements. And if you are taking a short-term treatment for a fever or some typhoid or something for 5 days, 7 days, you should stop all these herbal supplements. First treat yourself, stop that medicine, and then start with the herbal. And unnecessarily they are not to be taken because you do not know what they are going to do in your body, right? General instability, morophytotoxin, it is an anti-cancer drug. So this anti-tumor activity, so it has general instability. And then this is basically all. Now this computational screening and machine learning algorithms were previously used for only chemical compounds. When you go for medicinal chemistry, drug synthesis, you are using them. But nowadays you can use them for natural products also. Because they can predict what kind of modification you can do in a natural product, what kind of toxicity is expected, and what kind of bioactivity is expected. Even what can be the bioavailability of the drug, what can be drug distribution, what can be metabolic rate, what can be the excretory possibilities of that drug. Combining all that, you can make some drug. You need not extract all the drugs. Even extraction procedures that AI can give you, which will be the best extraction procedure, which will be the best solvent for the HPLC or chromatographic techniques. All these things can be given by AI. And then you actually do it, and actually doing is basically validation of that process. AI is telling you, you do something, this is good. When you do it, it matches with that. That AI tool is okay. Otherwise, AI tool may predict wrong. Predictions can always be wrong. You go to astrologer, okay, but similar to the AI tools, that AI tools, if they are predicting good, they can be used. There are numerous AI tools. Then it is the computerized design of new chemical entities, the generation of natural product inspired bioactive compounds through automatic molecule generally, and activity prediction is also there. And then you can do the target selectivity and all those things by artificial intelligence, right? This is the computer assisted this thing. This is again the use of this thing. These are detailed things. I am telling you the basics, because if one has to go into the research, he must first understand the AI. Go for a basic course like Google has, Coursera has. All you should go. I advise you to go all of them, including the faculty, because when you have a basic idea of it, then only you can bring into this thing. Because naturally the pharmacists are away from mathematical part, though they have been taught some mathematics and something, but they tend to be away from, because they are biologically this thing, so they will go this thing. So these things you have to understand only when you study some AI, because now they are introducing some AI courses into this thing. If they are not there, you go for some SWAYAM course or whatever it is. At least have basic knowledge, then you will create interest once you learn it, and then you can start. Even for literature surveys and all those things, these tools are very helpful, right? These are different types of tools that can be used for different types of activities. But then again, you need to have idea about them and what is their functioning. You need to have, some are free, some are chargeable. All these things that are done, they can be done by you see the extraction process optimization can be done. Because if you are extracting something, you are using a lot of solvent and you are evaporating it, not recovering, wasting it. It is not optimization. And the extract is coming very little. So you have to know which will be the best solvent for that, and minimum solvent will be required, and maximum extract will come. That will become the optimization of the process. That AI can predict it. So use that AI to predict that, right? Then structure prediction can be there, compound identification, data integration. Data integration, all the AIs, all these tools are very good to data integrate, to data analyze, to come at a result. These are again various tools. You can see them. And the future directions of AI. While current AI applications are primarily focused on molecular prediction and optimization, future innovations are expected to redefine the entire drug delivery ecosystem, right? They will focus on hybrid intelligence, automation, and precision therapeutics. So drug discovery, every other day the modifications are there. So we are refining the process, gradually the scientists are refining the process. So this is one area of research, AI with natural products. This is a very good theme, I tell you. Even for faculty also, when guiding M.Pharm students, these projects can be given to them with AI, this thing. And these are nowadays, because these are just started, taken off. So they are easily publishable. These are easily patentable, right? So instead of going for publication, go for patent. File a patent. After 2-3 years, produce the data and have a patent in your name. And students should be involved in that patenting this thing, right? Patent is basically an idea. Any idea that comes to your mind is basically innovation, right? So whatever idea you get, I don't know whether you have a patent cell here or not, but if it is there, you can have that verified and literature surveyed, and then if it is possible, you can do it, or otherwise you can modify it. So that can be done in this area, because this area has huge scope, right? Then clinical trials are one of the most expensive things. People are not ready, data set is not ready, then different areas you have to conduct, different parts of the world you have to conduct. Then AI can be used there to this thing. And patient outcomes, it will predict what will be there, and safeties. Additionally, it will analyze real world evidence such as electronic health records, wearable device data. These are available. You wear the data. Nowadays, you can check diabetes 24 hours. If you have a device that you put it here, all 15 days, 20 days, it will be there, and real time it will give you, so that you know whatever you have eaten, how the sugar has moved. So these wearable devices will be there. So this is about the, what you call natural products where we can use it, that I have already told it. The extraction procedures, the chromatographic techniques, their bioactivity, their toxicity studies, because these days use of animals is restricted. You cannot test everything on animals, right? So you can do that, right? Then preclinical safety and all these things that any herb can be monitored, because any herb, any plant that you take, it has many parts, from underground to aerial parts, right? And all have different actions and different constituents. So all the things can be predicted. One day will come that everything will be on this AI, right? And then that integration of AI into natural product research is still in nascent stages. And that is where the opportunity lies, right? To search it out कि क्या करें इसमें? इसमें अभी बहुत स्कोप है. इसमें हम जा सकते हैं, नई चीज़ें बना सकते हैं, और हम एक ऐसे चीज़ें प्रोड्यूस कर सकते हैं which can be useful to all the mankind, right? तो इसमें जो है, तो न्यू मॉलिक्यूल्स, न्यू ड्रग मॉलिक्यूल्स नेचुरल सोर्सेज से हमें निकालने के लिए, बिकॉज बिलीव मी, देखिए दिस नेचुरल फौना एंड फ्लोरा इज वेरी ओल्ड, न्यूमरस ईयर्स. आप किसी एक प्लांट को उठा लीजिए, एनी प्लांट, और उसमें पेपर्स देख लीजिए, न्यूमरस रिसर्च इज देयर. Even then it is not complete. You will find something to do into it. That means a plant itself is a reservoir of so many things. So natural resources में research का इतना स्कोप है जिसका आप बयान नहीं कर सकते, क्योंकि हम एक ही चीज़ को पूरा एक्सप्लोर नहीं कर पा रहे हैं. बहुत सिंपल से एग्जांपल्स हम लोग कहते हैं हल्दी है, करक्यूमिन, लाइक आई टेल यू, करक्यूमिन है ना हल्दी, हम लोग हल्दी खाते हैं भाई, ये हमारे बॉडी के काफ़ी चीज़ों को दूर करती है, मगर करक्यूमिन जो है इसका एब्जॉर्प्शन बायोअवेलेबिलिटी बहुत पुअर है, ये उतनी जाती ही नहीं है बॉडी के अंदर. अब ये चीज़ कब आई, पुरानी फॉक चल रहा है भी ऐसे है, बट देन जब रिसर्च आई तो पता चला बायोअवेलेबिलिटी इज पुअर, देन यू फाइंड वेज टू इंक्रीज द बायोअवेलेबिलिटी. ऐसी बहुत सारे मिथ्स और बहुत सारी चीज़ें हैं जिनको हम लोग यहाँ पर एक्सप्लोर कर सकते हैं. सो माई पॉइंट इज दिस कि दिस एरिया हैज़ ह्यूज पोटेंशियल ऑफ रिसर्च. और AI क्योंकि बिल्कुल नया है, एंड AI बिकॉज इट इज़ ए मशीन लर्निंग एंड मैथमेटिकल सॉर्ट ऑफ थिंग. सो मोस्ट ऑफ द इंजीनियरिंग पीपल आर इनटू AI. Healthcare professionals are not into the AI. They are making some devices to take the healthcare, but research in pharma, natural products, they are not doing it. They need it. Even companies will be after you. TCS is taking some persons from this background to mix this AI into their profiles, right? So thank you. This was a short, brief, presentation to.
It gives the immense pleasure to propose a vote of thanks for today's enlightening session. On behalf of Pravara Rural College of Pharmacy, Loni, I extend a heartful thank you to Dr. Satish Sardana sir for delivering such an insightful and thought-provoking session on the artificial intelligence in the drug delivery and the natural product research. Sir's lecture highlighted the bridges advanced computational approaches with the traditional natural product research, helping us understand how artificial intelligence can accelerate the lead identifications, optimizes drug development, and enhances the scientific value of the pharmacognosy research. His clarity of the thoughts, practical examples, and the future-oriented vision have truly inspired us. Sir has also focuses many of the concepts such as how the master students can get the new project oriented. They have focuses on the how the teachers can focuses on the how new AI can be implemented in the new research area. Thank you very much, sir, for this such a great information for us. Now I will request Siddharth Pagare to please come forward and give the introduction of the second speaker.
Thank you, Pratiksha. It is a pleasure to introduce Dr. Ganesh Dama, Principal and Professor of Pharmacognosy, SGMS PMS, Sharat Chandra Pawar College of Pharmacy, Otur, Pune. With over 26 years of academic and research experience, Dr. Dama is a recognized PhD guide at Savitribai Phule, Pune University, and has guided multiple PhD and MPharm scholars. He has authored 90 plus research publications, holds 9 granted patents, and has written 9 academic books. He has also served as a PCI inspector, NAC assessor, and Board of Studies member at SPPU. We are honored to have him with us today. Please join me in welcoming Professor Dr. Ganesh Dama.
Thank you so much, Siddhodhan. So, sir, I request you to start with your session.
A very good afternoon to all of you. Actually, I'm very thankful to the team of Pravara and the principal madam of Pravara College of Pharmacy to organize this seminar which is being sponsored by the ANRF for the 2 days national conference. And the theme is from the plants to the patient, the AI role in natural product research. And the topic that I am going to cover here for this session, it is the role of drug discovery, development, opportunities, and the challenges. Actually, the Sardana sir, he has elaborated the number of the things through AI, and he has warmed up you so that instead of wasting the time in the part of the introduction and all that, actually your brain has always been warmed up by him. So instead of giving so much time for the other things, I will continue with the session of the presentation of this topic, where we are going to cover here the number of things in these presentations. Sardana sir has gone for the natural products, but I am going to cover here the AI that is being used in overall pharmaceutical industries. What is the role of AI again for the applications in the pharmaceutical industry in every sectors. In every sector of the pharmaceutical fields, along with some of the examples, what are types of the tools and that of the applications that are being used in the AI. So here today we are going to cover here the AI in the life cycle of the pharmaceutical products, AI in the drug discovery, advancing pharmaceutical product developments, AI in pharmaceutical manufacturing, in clinical trial designs, even in quality control and quality assurance, even AI based in advanced applications, pharmaceutical market, ongoing challenges and conclusions in this session. So here we are going to see how the artificial intelligence actually has been recently started to gear up the applications in the various sectors of the pharmaceutical field as a frontline beneficiaries to the whole pharmaceutical world. And the impactful of the AI in the diverse area of the pharmaceutical sector, where it is may be dealing with that of the drug discovery and the development, drug repurposing, improving the pharmaceutical productivity, clinical trials, and to some of the reducing so that the application of the AI will reducing the human workload as well as achieving the time in a short period of times. We are also having to go for the crosstalks and the tools and that of the techniques that are being utilized in the artificial intelligence for the ongoing challenges also we are going to show, and how the ongoing challenges can be overcome, that we are also going to see in this today's lecture, along with the future of the AI in artificial intelligence in the pharmaceutical industries. So the AI actually involves the several methods of the domain for such as reasoning for the knowledge representation, to find out the solution search amongst them, and the fundamental paradigm for the machine learning. The machine learning network has many type of the applications. Actually, this is the small part that I am going to discuss along with you with some of the small figure, what types of the parts of the artificial intelligence that are going to be utilized along with the softwares and all that in this section. Here, this is where the AI in the life cycle of the pharmaceutical, where different applications of the AI in the drug discoveries and the development is begun. Where the artificial intelligence, where it is being divided in the machine learning. And machine learning, again, it is being divided into the artificial neural networks and that of the instant-based and decision tree algorithms. But here, if you see, where if you see this figure very carefully, where the artificial network, again, it is being divided into the recurrent neural networks and conventional neural networks, and where these RNN, in short, we are going to refer it the neural networks, recurrent neural networks. It is RNN, where RNN has the network with closed loops, having the capability to memorize and store the information such as Boltzmann constants, half-fill networks, and series of dynamic systems with local connection, which is being used to characterize the topology and how the images and the videos that you are going to utilize for the processing of the biological system modeling also, and processing the complex brain functions. So this recurrent neural network is also so much helpful for the identifications of where you are being utilizing the artificial intelligence. Even again the subfield of the machine learning, if you see the subfield of the machine learning as being again of artificial intelligence, it is being associated with that of the deep learning also. And that compresses, again it is what it consists of. The machine learning, what it consists of, it is also one of the important things that we have to know. And this compresses the set of interconnected, sophisticated computing elements that involving the perceptions and analogs for the human biological neurons and mimicking the transmissions of the electrical impulses in the human brains. Means such types of the systems with that of the applications of the artificial intelligence can be utilized for that purpose. And even again the ANN, that is the artificial neural network, it consists of the sets of nodes, each receiving a separate input, ultimately converting them into output either by single or multiple link using algorithm and problems. So the ANN also helps in various types, including the multilayer perceptrons, network recurrent neural, RNN, and that of the conventional neural network, which utilizes other supervised or unsupervised training purpose. So these, particularly the terminology such as recurrent neural network, conventional neural network, artificial neural networks, and such types of the terms that are being, or under this category, the artificial intelligence has developed the numbers of the models for the identification or for the use of the things. And So there we are going to discuss in detail about all such types of the things where what is the market position, how the artificial intelligence it is being utilized in the marketing, the position of the any product or of the company, or even in the drug discovery also, the drug design and drug screening, it is also being found to be helpful. Again, in pharmaceutical product management and pharmaceutical, even QA and QC, artificial intelligence is also found to be very important to speed up the processes and all that. And clinical trial designs for the selections of the patients for of specific category, it also helps in that role also. So there are the vast chemical space which comprises less than that of 1060 molecules from the Foster development for the large numbers of the molecule. Hence, that of the lack of advanced technology limits the drug development processes, but making it time consuming and expensive cost, which has been to be addressed with the help of the artificial intelligence. And the AI actually recognize hit and lead compounds and provide the quicker validations of any compound of the targeted drug, and optimization of the drug structure design can be helpful with the help of AI. So even the quantitative structure relationship based upon that of the computational model can be quickly predicted through the numbers of the compounds again. And in 2012, the MARC supported the QSR machine learning challenges to observe the advantages of the deep learning processes to discover the process in pharmaceutical industry. So while using the DL model, the deep learning, which is a part of again machine learning, but they have accepted the challenge. And that deep learning model shows the significant productivity compared to that of the traditional machine learning approaches for absorption, distribution, metabolism, excretion, and toxicity sets of drug candidate. So the data of the drug, it should also important to store. And in case of the absorption, distribution, metabolism, and excretion, the deep learning has shown the productivity. So the virtual chemical space is enormous, and which also suggests the geographical maps of the molecules by illustrating the distributions of the molecules in the properties. Again, this figure is also shown by Sardana sir. So I was actually in the puzzle that if the total both of presentation will be same, what to do. But again, after going on the further, Sardana sir, he has diverted towards that of the natural products. But I am showing you the examples along with that of the applications of the AI in the pharmaceutical industry. So again, AI, it is being found to be helpful in the discovery of that of the drug designs, in polypharmacological, in chemical synthesis, in drug repurposing, and in drug screening. Where with in case of the drug design, you can predict the 3D structure of the targeted protein, drug-protein interactions, determination of the drug activity, and novel drug delivery system can also be where the artificial intelligence can be utilized. Even biophysical drug molecule, multi-targeted drug molecules can be helpful for designing with the help of artificial intelligence. Even prediction of the reaction yield in case of the chemistry again. Here, where the reaction yield or retrosynthesis pathways and that of the reaction mechanisms can also be identified, even the therapeutic targets and that of the therapeutic uses in drug repurposing. And for screening, the toxicity, bioactivity, and physiochemical properties and that of the classification of the target cells can also be identified with the help of the artificial or by the applications of the so the artificial intelligence in the drug discovery, where we can go for the predictions of that of the, with the help of the use of artificial, you can also identify the or predict the physicochemical properties, where the physicochemical properties such as solubility, partition coefficient, degree of ionization, intrinsic permeability of the drug, and that of the indirectly it will affect the pharmacokinetic properties. And that's why it's to the target receptor family. Hence, it should be considered while designing of the drugs. So, the physical chemical properties is also one of the important thing that should be considered while you applying the use of AI in drug designing. So, the different AI tools models that can use to predict the physicochemical properties in case see, for example, the machine learning uses the large data sets that are being produced, or where the compound optimization data has been earlierly produced to train the programs. To train the programs, you should need the data while using the artificial intelligence. So the algorithm of the drug design also includes the molecular disruptors of the molecules, such as similar strings, with potential energy measurement, electron density of the molecule to coordinate the atoms into the 3D and to generate the physical molecules via the applications of the DNN and thereby predicts its property. I have told you DNN, ANN, these are the tools of the machine learning that are under classified by the AI. So this is the one of the tool that has been used to for defining the drug design for the molecules. Even the natural network based, it is again one of the examples where the natural network based of ADMT predictors and algos programs were also being used to predict the life helicity and that of the solubility of the various compounds. So even if you go for the prediction of the bioactivity of the compounds by using the AI, you should also you should remain in the mind that the efficacy of any drug molecule, it will depends upon the the affinity of the target of the protein or that of the receptors. So the drug molecule do not show any type of the interactions or affinity towards the targeted protein, will not be able to show its therapeutic properties. So in some instance it might be any drug molecule or any new drug molecule will also interact with that of the receptor, but intending the protein or the receptor, unintended protein or receptor, that may lead sometimes to the toxicity. Hence here it is necessary that the drug target binding affinity should be vital to predict the drug target interactions. So the AI here, the AI based methods can measure the binding affinity of the drug also by considering either the features or similarity of the drug and its target. But in case of the feature-based interaction, it will recognize the chemical moiety of the drug and that of the target to determine the feature vectors. While in contrast, the similar-based interactions, the similarity between the drug is considered and it is being also assumed that the similar drug will interact with that of the same targets. So the web applications such as K-Mapper and similarly enable the approach are available for predicting the drug target interaction. Means AI can also utilize in the drug target interactions, but by using the applications of the web applications such as K-Mapper. So even in prediction of the toxicity also, if you see the prediction of the toxicity of any drug or a molecule, it is also important or vital to avoid the toxic effects also. In case of the cell-based assays or in vitro assays are usually performed on the preliminary study, which is being followed by the animal study again to find out the toxicity of the any compound. But that may lead to the again increase in the expenses of the drug discovery. So the several web-based tools such as LimTox, PKCSM, Admit SAR and ToxFree are also available to reduce this cost. Again, so the advanced AI-based approach look like the similarity among the compounds and the project toxicity of the compound based in the input features. So the toxicity, it can be also addressed by using the artificial tools, by using the such as the web-based tools. So even for predicting the toxicity, the Tox21 data challenge was also organized by National Institute of Health, Environmental Protection Agency, US FDA, which was an initiative to evaluate the numbers of the several compounds to forecast the toxicity of near about 1270 environmental compounds and the drugs. But the machine algorithm, again, where machine algorithm and the deep tox, which outperforms all the methods by identifying the statics and the data of the dynamic features of the with chemical disruptor of the molecule, such as molecular weight, van der Waals volumes, and could efficiently predict the toxicity of the molecule based on predefined 24 toxicofeature features. Means the data, it should be available. The authorized data, it should be available when you are implementing the AI for any type of the compound or to predict the toxicity of any type of the molecule, so that it will be make easier to make the application or to use the applications of the AI for the determining the toxicity of the molecules. So even the open source tools such as TargetTox and ProOctor are also used for the prediction of the toxicity. These are again tools. Even it can produce the proteinoid pharmacological and functional properties in machine learning classifier to predict the drug toxicity. Here the AI which is being used in the case of the drug molecule, where it can be used in the prediction of the target protein structure. So while designing any type of the drug molecule, it is essential to assign the correct target for that of the successful treatments. So the numerous proteins are also involved in the certain types of the diseases, and in some cases they are overexpressed. So hence for the selective targeting disease, it is vital to predict the structure of the target protein to design any type of the drug molecule. So even again here we are going to see the target protein structure, where the AI can assist the structure-based drug discovery by predicting the 3D protein structures, because the designing it will be in accordance with that of the chemical environment of the targeted protein site, and thus helping to predict the effect of the compound on the target along with the safety consideration before the synthesis of any type of the molecules. It means here you can also define when the interaction of the drug interaction and that of the targeted protein is also important, but it should be requires the different conditions. Again, here are some of the tools that are being used. The AI tools AlphaFold, which is based on DNS, was also used to analyze the distance between the adjacent amino acids and the corresponding angles of the peptide bonds to predict the 3D protein structures, and demonstrate the excellent result, correctly predicting near about 25 compounds out of the 43 compounds. Means it also helps, but not every time the AI it will not be sure to show the predictions of the binding and the structure activity also. So here the predicting the drug protein structure, again the drug protein structure requires the subsequent incorporation of the suitable dosage form, so that it can deliver the desired characteristics of the molecules. And in some cases in this area, the AI can also replace some of the trial error and that of the approach areas also. So the various computational tools can also resolve the problem encountered in the formulation of the design area, such as solubility issue, dissolution and porosity. It can also be addressed with the help of the QSPR. Means with the help of these tools again, in the manufacturing process, it might be the stability issue, dissolution, porosity can be addressed with the help of the QSPR. So again here the decision support tools which are being used on the rule-based systems to select the type, nature, quality and quantity of the excipients that are being required in the and excipient that depends upon the physicochemical attributes of the drug, and operate through the feedback mechanism to monitor the entire process, and intermittently it will also modify the process. Means why selecting such type or making the applications by selecting that of the excipients, they can also modify the process. The AI can also modify also suggest the process during the manufacturing. So the GEO and ETAL integrated expert system and ANN to create, and they have created, this is the hybrid system that has been used for direct filling of the gelatin capsule of Proximon, and which was being in accordance with that of the specifications of the dissolution profile. Hence AI it is being used in the different processes also. Again we are going to see here another process. Again here the increasing complexity particularly in the manufacturing processes particularly, along with that of the increasing demand of the efficacy and the better quality is being expected every time. And in that case, the modern manufacturing systems are trying to confirm the human knowledge on the machines, so that it will speed up the manufacturing processes also. So the incorporation of the AI in manufacturing process has boosted the pharmaceutical sector or industry. So the talks such as CFD and Renault Average Navier Stock Solver Technology has studied the impact of agitation and stress level in different equipments exploiting the atomization in the pharmaceutical industry. Means agitation and the stress level when the tablet manufacturing is going on at that time, such type of the problems are being found to be addressed by using the CFD Renault, so that it's making the exploitation in the pharmaceutical industry. The similar systems such as direct neural simulation and large area simulations involves the advanced approaches to solve the complicated flow in the pharmaceutical industry also. So here the novel Champer platform helps in digital atomization even for the synthesis of the manufacturing the molecule, incorporating the various chemical code, operating by using the scripting language known as chemical assembly, and thus it has been successfully used for the synthesis and the manufacture of that of the sal-defined diphenylhydramine hydrochloride, rufinamide with the yield and purity similar to that of the natural synthesis. In case of the natural synthesis, as compared to natural, it is also being found to be incorporated. And the estimated, in case of the granulation system, when in pharmaceutical industry granulation is being done before, it goes for the tablet process. So the estimated complication of the granulation in the granulator of capacity ranging from 25 to 600 can be efficiently addressed by the help of the AI technology also. And the technology such as neurophysiologic, which was being correlated critical variables to these processes, and they derived a polynomial equations for the prediction of the proportion of that of the granulating fluid, how much granulating fluid that has to be added, and for the required speeds and the diameters of the amplifier, both geometrically similar and dissimilar granulators. So again, it is for granulation purpose, the AI it can also be added. So here again, DEM, which was being widely used in pharmaceutical industry for even for the studying the segregations of the powder in the binary mixtures, even the number of things, even segregation of the binary, even the effect of the varying the blade shape and that of the size, even predicting the possible path of the tablet in the coating process, and even by analyzing how much time that the tablet has been spent in the spray zone, it can be addressed by the DEM software which was being utilized in the pharmaceutical industries. Even in this case, the ANN along with the Fuzzy model studied the correlation between the machine setting and that of the problem of the capping to reduce the tablet capping in the manufacturing lines. So even here, the meta classifier, these are again the tools, meta classifier and the tablet classifier tools helps to gauge the quality of the standards of the final product, indicating the possible error in the manufacturing of the tablets. So these are some of the models again that are being used in the pharmaceutical industry which can be overcome. So in even the manufacturing of that of the desired product, whenever we are expecting any standard or quality product or a desired product from the raw material, it includes again the balance of the various parameters, and that may include the quality control, where quality control and quality assurance again it is important when any product is being found to be manufactured from the raw material. So quality control test of any type of the product as well as the maintenance from the batch to batch with the consistent batch to batch again requires the manual interface, and that might be the best approach showing the need of the AI in this implication of that of the to bring out the at every stage. So the FDA amended the current good manufacturing practice by introducing the quality by design approach to understand the critical operation and specific criteria to govern the quality of the final product. Means the FDA it is also been governing. They have introduced before that of the year to have the quality by design that of the product in the market. And now here we see how the AI it is being found to be implemented in the that of the clinical trials. Even the clinical trials, it is whenever it is being found to be performed or it is being directed towards the safety and efficacy of the drug particularly in the human for that of the particular diseases, and which requires near about 6 to 7 years and with substantial cost, financial cost also. And to out of whenever any type of the clinical trials are being carried out, near about 1 out of that of the 10 molecules, only 1 molecule out of 10, it can overcome all the clinical trials, and that will again the massive loss of the pharmaceutical industry. So this failure, it can be carried out by due to the inappropriate patient selection. Why these failures are being obtaining are the patient selection, a shortage of technical requirement, and even that of the poor infrastructure is also one of the factor that is affecting that clinical trials are not being obtained at the mark. So however, the vast digital data that is being available, earlier data that is available, this failure can be reduced by the implementation of the AI. So the enrollment of the patients also, it is one of the important thing that takes 1/3 of the clinical trial timeline. It means again, that's why it is making to the time consuming. So the success of the clinical trial always ensured by the recruitment of the suitable patients for that of the clinical trials. So the AI can assist in selecting only the specific disease population for the requirement of the phase 2 and phase 3 clinical trials by using the patient specific and genome exponent profile analysis, which can help in early prediction of availability of the drug target in selected patients. So the proper selection of the patient, it can be helpful with the help of the AI. So the preclinical, particularly the preclinical discovery of the molecule in the clinical trials actually, as well as it may lead to the predicting the lead compounds before the startup of the clinical trial by using the other aspects such as AI, even it may be the predictive machine learning or the other techniques also that will help in early prediction of the lead compounds that will pass all clinical trials considering the data of the patient, whatever they are being selected through the AI. So AI also helps in while making the clinical trials, it will also help in selection of the specific patient genome. That is one of the important things while you are selecting the patients. So in market positioning again, the AI which is being used in the market position, the approach to find out the market position of any product of any company is also important to know them. So this approach was used in the marketing pioneer brand of Vigara, where the company targeted is not only to treatment the man's erectile dysfunction, but also the other problems affecting the quality of the life. It was the first product that was being used to find out the marketing position, because now with the help of such type of the technology and that of the e-commerce platform, the company, it has been becoming easier for the natural recognitions of their brand and in the public domain. So advertising company continuously trying to bring their website at the top of the position in compared to that of the others, so that they get the recognition for their brand, and in a short period of time they can achieve the targets. And even the advertising here, the success of the company, particularly every success of the company, it lies into the continuous development, growth and its business. Even the access of substantial funds that are being available with the companies for the development of their R&Ds in pharmaceutical industry is falling because the failure of the companies to adopt the new marketing. So the new marketing technology should be adopted to build their brands in the public domains. So yeah, even the advances in digital technology is also one of the important thing, and which refers to the fourth revolution by using the AI, by helping the innovative digital marketing by multi-care decision making approaches, which collects and analyzes the statistical and mathematical data, implements the human interface to make the AI-based decision making models to explore the new marketing technology. For new marketing technology should be adopted for to bring the products more into the public domain. And several B2B businesses are nowadays found to be available on social media or even such like the Amazon or Flipkart. Such types of the market platforms are being available to bring the brands, even B2B business, direct approaches towards the company or to the customers. They made their products available for the browsing on the sites, finding its specification of that particular product, to place the order, and whatever the order that has been placed, it is again the part of that of the artificial intelligence, where the product can build, where the company can build their product brand also in the public domain again. The pharmaceutical companies are also introducing the online applications such as Tata 1mg. It is one of the pharmaceutical company which is being used in making the prediction and analysis. These companies, 1mg, Medicine, NetMed, Ask Apollo, it will fulfill the unmet needs of that of the patient. Means the requirement of the marketing, the useful of the to bring out the market positions, it is also one of the more important thing to build the brand in the market. And AI in pharmaceutical product management, where the AI for the product cost, particularly even every time you are well known for this, that the market analysis, based on the market analysis and the cost incurred in the development of any type of the drug molecule, that on that basis the company, it will determine the cost of their product. And the factors such as whenever any company is defining the cost of the product, they consider the factors such as the expenditure that are being done during the research and development of the drug, the strict prices controlled into the respective countries also, in concerned country, length and exclusive period, what is the market share of that of the innovated drug in the drug after the year before the patent expires, and the prices of the reference products, and price filing policy determines the price of the branded and the generic drug. Whenever the patent it is being to be finished, then they became that of the generic and that of the drugs. So here, these are the things. So the AI based, even it is being nanorobots. Nanorobots are also utilized for the drug delivery, and the nanorobot comprises mainly of what the nanorobots, what it is, artificial intelligence, what it is being utilizing. It is being particularly where the drug delivery it can be done by the using nanorobots, which comprises the integrated circuit, sensor, power supply to secure the backup data, and which is being maintained via the computational techniques such as the AI also. So particularly these nanorobots are being found to be programmed to avoid the collision, target identification, to detach, attach, and finally excretion from the body also. So the advanced nano and micro robots gives the ability to navigate the targeted drug delivery system based upon physiological conditions such as pH, and improving the efficacy and reducing the systemic adverse effect also. So in delivery system also nanorobots can be helpful, and even the development of the implantable nanorobots into the can be developed by using the controlled drug delivery and gene that requires the consideration parameters such as the dose adjustment, sustained release, controlled release, and release of the drug that requires again. Through nanorobot release of the drug, it requires the atomization control tools that are used, AI tools and NNS physiologic and integrators. Such types of the tools are also found to be used while for the delivery of the drug for the patients, whereas the microchip implants are also used, which are being programmed chips which releases the drug as well as detect the location from the implant from the body also. So AI combination, while to see the synergistic effect, or the AI application to see the synergistic effect also, the several combinations of the approved and that of the marketed drugs are also being found to be available to treat the diseases such as TB and the cancer that shows the synergistic effect also. So the cancer therapy requires near about 6 to 7 types of the drug combinations which for the treatment of the treatments. So even in this case, where the ANN logistic approach, these are again now the AI tools. The ANN logistic regression, network-based modeling can screen the drug combination and improve the overall dose for the patients. So even the Rashid et al. And the quadratic phenotype optimization platform being used for the detection of the optimal combination therapy for the determination by use in the myeloma, where they have used near about 114 drugs, FDA approved drug also they are being found to be utilized. So this is regarding the number of the things that are being covered under the different categories. Now I will go for that of the, instead of, these are the synergistic antagonism effect, even these are the tools that are being found to be used along with that of the in association with AI organizations or the application tools are being utilized here. And AI-based advanced applications, here I have been summarized for you, even to decrease the financial cost particularly, even the chances of the failure of the company, pharmaceutical companies are also found to be shifting towards that of the AI also. But if you see the market of the AI, as far as compared, it is the increasing market. If you see the $2,000 million was in the 2015, which was being found to be increased up to 40% by 2024, and by 2023 it has been found to be increased up to 46% the utilization of that of the AI tools. So here the ongoing challenges are also for adopting while you are going to be adopting the artificial intelligence. So the potential benefit of the drug discovery, it is also being associated with the challenges and that of the limitations, and that has to be considered. And one of the key challenges is the availability of that of the suitable data. The suitable data is being utilized or being used for whatever may be available to train the process for the training purposes of the machine learning. So in some cases, the amount of the data that is also sometimes that is being available, it might be incorrect, and that incorrect data, it should be, incorrect data will also not be useful for the identifications of the compounds. So for the data such as machine learning algorithms, sometimes they are biased or unrepresentative, that resulting in the prediction of the inaccurate and the unfair. So the unfair data, it is not found to be. So that's why ensuring the ethical and the fair use of the artificial intelligence is also found to be very important for the development of the new therapeutic compounds. And at the end, the advances of the AI along with the remarkable tools continuously aim to reduce the challenges in the pharmaceutical companies impacting the drug development process along with the overall life cycle of the product, which can explain the increase in the number of the tools or the new startups for the such type of the newcomers. So in coming years, the projects, whatever may be the UG product or PG products, whatever the faculties are there, they should also go for the implementations of the AI. The interdisciplinary means taking the use for the any type of the development process or for your projects, the faculty also should take the use of the whatever the you might in this Pravara premise, it is the big one. You might be having the artificial intelligence department also, AI department also. So you can make the use of that artificial intelligence department for the development of any new process or new product to so that you can come up with the new type of the projects and so can for the publications also. So again here, the most significant worrying regarding this the incorporation of the artificial intelligence and that of the technology is the job losses, and that would also follow, and strict regulation should be needed for the implications of the AI. So we should not be feared that use of AI intelligence or can be lose our jobs. Hence the system should be intended only to mark. This system is particularly, it should be utilized for the so that you can make your work easier and not to completely replace the human beings. You should not think that a human being will be replaced by the AI. It will not happen. Unless and until your brain works to train the machines unless and until it will not work. So you should not be getting me operating of the losing your jobs and all that. So this is the conclusion. You should not be getting afraid of all the things or that of the, to lose the jobs. So with this I conclude with the conclusion of this session of this seminar, and I am thankful to listening, for organizing, for inviting me for here for this today's seminar. I am thankful to the Pravara team and all the management team. Thank you.
Thank you so much, sir. I request sir to have a seat. So please have a seat.
Thank you so much, sir. It gives the immense pleasure to propose the vote of thanks for today's enlightening session. On behalf of Pravara Rural College of Pharmacy, Loni, I extend a heartfelt gratitude to Dr. Ganesh Dama, sir, for delivering such an insightful and thoughtful session on the role of AI in drug discovery and natural product research. Sir focuses on how AI is revolutionizing drug discovery, accelerating lead identification, and optimizing the product research and bridging the knowledge with modern and traditional computational tools. The clarity and the depth of the presentation have truly inspired all of us and broadened our scientific perspective. Thank you, sir, for such a great, valuable session. We all are present here are extremely grateful to both the speakers of morning session, Dr. Satish Sardana sir and also the Dr. Ganesh Dama sir, for sharing valuable knowledge and expertise and time with us. Your both sessions broadens our perspective and will serve as a guiding light for our future researchers. I would also like to express my sincere thanks to our respected principal ma'am, management, conference arranging committee, faculty members, coordinators and all the participants for their active involvement in making the grand success of morning session. Thank you all of you.
Thank you, Pratiksha. So here we conclude our morning session of first day of conference is over. So warm thank you to Dr. Satish Sardana sir and Dr. Ganesh Dama sir. So dear delegates, we will be taking break for 1 hour till 2 o'clock. Our afternoon session will promptly start at 2 p.m. So proceed for lunch. Our volunteers will guide you for the location of lunch. So we will be taking break till 2 p.m. Afternoon session will sharply start at 2 p.m. So firstly, girls will be seated for a while. Let the guests leave the hall, and then first girls will leave the hall and then boys will leave the hall. So whoever are the participants for oral and poster presentation from you, kindly submit your e-posters and presentations to the team. Okay, our volunteers will guide you for the same. Go and contact at the registration team. Sharp at 2 p.m. our afternoon session will resume. That will be practical session by Dr. K.S. Ladda sir. Practically, he will be performing practical on cognosy. So that will be live practical session. Everyone promptly get gathered in the seminar hall. In the same seminar hall.
Hello. 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 Check.